Hi, my name is Dr. Leslie Mendoza Temple, and I'm the Medical Director of the Integrative Medicine Program at North Shore University Health System. Bowel dysfunction refers to problems with the frequency, consistency, and/or the ability to control your bowel movements. After treatments for prostate cancer, especially radiation therapy, men may have trouble with their bowel movements. Two common problems are constipation and diarrhea. Constipation is a condition in which bowel movements occur less often than is normal for an individual, or when the stool is small, hard, and/or difficult to pass. There are several dietary strategies that might help you prevent and treat constipation. First of all, drink at least 6 to 8 cups of liquid each day. A glass of prune juice or a hot beverage such as tea, coffee, or lemon water taken in the morning may help you achieve regularity. Include high-fiber foods in your daily diet. Fiber helps to move foods through the intestines and out of the body. High-fiber foods include cruciferous vegetables like cabbage, broccoli, Brussels sprouts, rutabagas, turnips, and cauliflower. Fruits such as apples, pears, grapes, and berries. Nuts and seeds. Peas, beans, and lentils. Popcorn. Whole grain products such as breads, cereals, and pasta made with 100% whole wheat, barley, oats, corn, and rye. Eat at least 3 servings of raw vegetables or fruits every day. Select fruit with edible skin such as apples, pears, and potatoes. And choose fiber-rich grains such as brown rice instead of white rice and whole grain bread instead of white bread. Unprocessed bran is a dietary fiber supplement that may be added to your cereal, beverages, or baked goods to increase your fiber intake. Add 1 additional serving of high-fiber foods every 2 to 3 days to let your colon adjust and to prevent excess gas and stomach discomfort. Limit foods that can contribute to constipation, such as cheese, processed meats, and other low-fiber foods. Diarrhea, on the other hand, is the frequent passing of liquid or unformed stool. This condition is usually accompanied by an urgent need to use the bathroom and/or abdominal discomfort with cramps. Acute diarrhea does not last long. It is very important to replace the liquids that are lost due to diarrhea. Drink at least a cup or 8 ounces of fluid for every loose bowel movement. Pale, plentiful urine indicates that you are drinking enough fluids. Choose liquids such as water, broth, jello, fruit ice, weak tea, sports drinks, and carbonated drinks. Carbonated drinks are better tolerated when they are flat or they've lost their fizz. Avoid beverages that have a lot of sugar, such as juices and fruit aids. Also, avoid caffeinated drinks such as coffee, strong tea, caffeinated sodas, and chocolate. These beverages can make diarrhea worse. It is also important to replace the nutrients that are lost due to diarrhea, specifically potassium. Choose foods that are high in potassium, such as potatoes without the skin, bananas, yogurt, citrus fruit, melons, and meat. Avoid foods that are very hot or very cold. Foods of extreme temperatures may aggravate diarrhea. Avoid foods that are high in insoluble fiber. These foods include raw fruits and vegetables, whole grain breads, whole grain cereals, nuts, and seeds. Choose foods high in soluble fiber. These foods include oats, barley, peeled fruits, and fiber products like Metamucil and Benefiber. This kind of fiber acts like a sponge to absorb excess fluid, which helps control diarrhea. Limit your intake of sweets such as sugar, desserts, and candy. These foods can make your diarrhea worse. Also avoid foods sweetened with the sugar-free alcohol sorbitol. Sorbitol is used in many sugar-free gums, candies, and medicines. This sugar alcohol causes diarrhea for many individuals. Avoid fatty, greasy, and spicy foods. Foods should be prepared without added fats or spices. Avoid dairy products high in lactose or milk sugar. These foods include cow's milk, ice cream, and soft cheese. The lactose in these foods are difficult to digest during periods of diarrhea. Choose dairy products low in lactose or milk sugar. These foods include yogurt, cottage cheese, and hard cheeses. Yogurt and hard cheeses also have probiotics or healthy bacteria that help your intestine and prevent diarrhea. Avoid gas-forming foods such as onions, cabbage, broccoli, cauliflower, Brussels sprouts, and baked beans. Eat small meals often, every 3 to 4 hours. Small meals reduce bloating and abdominal discomfort. Sit or lie down for at least 15 minutes after eating. By resting, you can slow the contractions that push food through your intestinal tract. As your symptoms lessen and you begin to feel better, Gradually add bland, low-fiber foods like eggs, yogurt, rice, potatoes, plain pasta, dry toast, crackers, hot cereal, canned fruits, applesauce, and bananas. Depending on the causes of your problems, you may be able to prevent, manage, and/or treat bowel irregularities.